Hi everyone, this is Dr. Aurelie Najm from Glasgow, reporting for REM now. So I hope you really enjoyed the past 3 days of conference. Today's the last day, and I have found this very nice presentation that I wanted to share with you. So I think as far as I remember, attending rheumatology clinics, I've always heard patients telling me, oh, doctor, the other day it was raining and my joints were so sore. I can definitely do, weather forecast based on my joints. And, it was always, I could never really answer that question. And it's always been a bit of a, struggle. But today with Abstract 1912, we actually have an answer. So this group from Vienna, what they basically did is that they looked into a cohort of above 400 patients for over a period of 12 years. And they looked into a wide range of, weather-related parameters like temperature, absolute and relative humidity, dew point, and the level of precipitation. And of course, something you can think is, because I'm from Glasgow, obviously it rains a lot, so we have a lot of that. But in general, it was very interesting to see. So what they did is they looked at whether these weather parameters had different effects based on patients' disease activity. And actually, the very interesting thing they saw is that patients with high or moderate disease activity of their rheumatoid arthritis were experiencing less pain when the temperature was higher, but also a higher number of swollen joints and higher amount of pain when the humidity was increased. Now, these findings were not the same for patients with low disease activity. These patients had high humidity. When they have a high humidity or dew point, actually, the patient global was lower. And there was no relation with the other parameters in patients with low disease activity. So, I think this is a very interesting work because we've heard that, and it's a very old concept that, weather can influence pain or, patient global or disease activity. And we get an answer that shows, that it's actually linked. Now, what we would really want to know is why. I hope we're going to have some answers to this question in the next years. At least now I know what to tell my patients when they ask me. Stay tuned with Remnar for more of this great scientific content, and follow me on Twitter at Aurelie Reumo.